Hi there and welcome. My name is Dr. Waqas Kayani. I work with the World Parkinson's Program and I welcome you to our latest initiative. I shall be spearheading a brand new online educational campaign in which we shall be bringing healthcare professionals from every spectrum of healthcare to come in and talk about special topics that are related to Parkinson's disease but are not always thought of when a patient is initially diagnosed with Parkinson's disease. It is our sincere hope that through this new initiative we are going to be able to further educate and bring awareness to special topics that are not always thought of when a patient is initially diagnosed with Parkinson's disease, yet are vitally important for their future well-being. Now, this being our introductory video, I would like to introduce the World Parkinson's Program. We are a Canadian-based global non-for-profit organization with the aim of improving the lives of those affected with Parkinson's disease both directly and indirectly. Our aim is to reach every individual that has been affected with Parkinson's disease, to educate them in their own language, to provide support services, as well as to advocate for them both at a local and global level. Those who fight Parkinson's with knowledge always find a solution. This is the central theme to our program. The World Parkinson's Program is the brainchild of Dr. A.Q. Rana, a Canadian-based neurologist, and through his efforts and like-minded individuals, this program now has chapters in many countries all across the world. Now, in our introductory video, we selected a topic that is rarely thought of when a patient is initially diagnosed with Parkinson's disease, yet can have a significant impact upon their lives, and that is oral and dental health care. To discuss this topic, we have brought together two world-renowned experts in the field of oral and dental health care. These individuals shall be discussing both from a general standpoint what a Parkinson's disease patient should discuss with their oral and dental hygienist and dentist, as well as two topics, namely drooling and the importance of electronic toothbrushes. Our first expert is Dr. Melanie Simmerbeck. Dr. Simmerbeck is a professor in the Department of Dental Public Health and Behavioral Science at the University of Missouri Kansas City School of Dentistry. She has been a full-time faculty member at UMKC, teaching dental and dental hygiene students since 2004. Dr. Simmerbeck is a health services and implementation science researcher with an interdisciplinary background in oral and craniofacial sciences and public affairs and administration. Prior to pursuing a career in education and research, she was a registered dental hygienist and delivered oral health care to patients diagnosed with a variety of healthcare needs, including Parkinson's disease. Her research and teaching interests are access to oral health care, oral health disparities, special patient care such as Parkinson's disease patients, and dental workforce models as well as quality assessment. She shall be going over fundamental general topics that every Parkinson's disease patient must discuss with their oral health expert.
A diagnosis of Parkinson's disease can be traumatic for both the patient and their family and friends. And after receiving this diagnosis, there are a number of items that the patient and his or her family must consider. One item that is easily overlooked is oral health care. Patients diagnosed with Parkinson's disease frequently experience problems with their oral health, such as dry mouth, drooling, burning mouth pain, and loss of taste. Factors such as medications, nutritional deficiencies, and inability to remove plaque can contribute to these problems. Patients may also experience difficulty swallowing. This can lead to choking, sudden uncontrollable coughing, and silent aspiration pneumonia. Patients and caregivers should discuss these potential problems with their dentist and dental hygienist because they may lead to inadequate home care and increased risk for developing dental caries or cavities, periodontal disease or gum disease, tooth mobility, and tooth loss. And ultimately, this can lead to decreased quality of life. Many patients diagnosed with Parkinson's disease have been taking levodopa for a number of years. It is important for patients and caregivers to be aware of how long they have been taking levodopa and report this information at their dental appointment. A long-term side effect of levodopa is involuntary movements, and involuntary movements can affect a patient's jaw and make it difficult for the oral health care provider to access the patient's mouth. Patients and caregivers should report what involuntary movements, if any, the patient is experiencing. And finally, patients diagnosed with Parkinson's disease are at high risk for developing dental caries. It is important for patients to proactively prevent developing dental caries. Some preventive measures that have been shown to be beneficial include dental prophylaxis every 3 months, having fluoride applied at the prophylaxis, having a prescription fluoride that has high concentration of fluoride in the toothpaste, and using a mechanical toothbrush to remove plaque at home.
And this concludes our introductory video. I'd like to thank Dr. Melanie Simmerbeck for her initial introduction into the field of oral and dental healthcare as it's related to Parkinson's disease. Please log on to our website at www.pdprogram.org, and under the blog section, you shall find our newsletter, where we will be continuing our online educational campaign season in the field of oral and dental healthcare. Dr. Melanie Simmerbeck and Dr. Rana shall be discussing in greater detail the use of electronic toothbrushes as well as the issues related to drooling. Thank you once again for viewing our video, and please support us in any way you can. Take care.